Hey everybody, in today's video, this is part 4 of performance enhancement and performance-based practice. I just want to explain another aspect of what happens when some muscles aren't working well, what the effect that has on all of your muscles and how our body is able to move. So this is a little bit more complex, and it's really quite challenging to understand this sometimes. So if you haven't seen the previous 3 videos, I highly recommend you watch all 3 videos before this one, and then this will make a lot more sense, so I don't have to repeat myself too much. So in this video, I just want to talk about what happens when you have extrinsic muscles that are tight, which are contracting as a result of a joint instability. So if you saw the previous episodes, you know what that means. So we're starting from the point of having extrinsic muscles that are tight, and they're compromising our strength and flexibility and endurance of those muscles. So in this one, I'm going to use an example of pain, or rather tension, in the back of the hip. So if you have posterior hip pain, which a lot of people do, these are muscles that can get tight, and they can get tight to try to stabilize an unstable hip. They could also be tight because of an unstable spine as well. So we're not going to make any presumptions of one or the other, but I just want to explain what happens in a typical scenario where you have posterior hip tension. So if we have some instability, I will just keep it quite loose right now, which is creating a scenario where we have extrinsic muscles contracting to prevent a certain motion. So in other words, if we were, say, in our lumbar spine, that when we bend forward and to the side, that we're going to be stretching muscles in our spine that are unstable. So what we're going to be doing is trying to stop that motion from happening. So what will typically happen is, if those intrinsic muscles can't resist the function, what will happen is extrinsic muscles will contract to try to resist all motion in that direction. So in the lumbar spine, that's what we call the erector spinae, they will contract to try to compensate for a weakness of these, like a multifidus in this example. If it's anterior and lateral, it's multifidus, which is going to resist that motion. That's the intrinsic muscle. So if that intrinsic multifidus isn't working, erector spinae, in a very general sense, are generally going to be the muscles that are going to contract to try to resist it. Now, erector spinae go down into the pelvis, and they fire in a chain with your posterior hip muscles, because generally extrinsic muscles are designed to move you. So when you're normally contracting your erector spinae, that's to actually bring your back from flexion into extension and to rotate your spine so that you can actually propel yourself forward as you're taking a step. So that muscle is really designed not to keep you, stuck like this. It's designed to actually move you. So in its ideal function, it's contracting to propel you forward, and at the same time, you're contracting the posterior hip muscles, because that's going to bring your thigh back as you're standing on that leg, and as you bring your thigh back, you're pushing your body forward. That's how you take a step. So the erector spinae and the posterior hip muscles should contract at the same time to try to propel you forward. But if we have an instability in the lumbar spine, that where your body compensates or recruits muscles to try to stop that from the joint from moving in that direction, it's going to take the erector spinae muscles and tighten them up. We'll see that the state of tone of the erector spinae muscles comes up. And very similarly, because they're fired in a sequence, the posterior hip muscles will get tight. So it's not uncommon to see erector spinae tension and posterior hip tension at the same time. So a typical scenario is someone will come in and they'll say, oh, I have this pain in the back of the hip, or I have pain in the back of the hip and sensation of pain going down my leg. You could actually have compromise of the blood flow to the sciatic nerve, or even compromise of the sciatic nerve if there's enough tension on the back of that hip. Or it could be coming from the disc as well, because the disc is unstable, the joint is unstable, and you've traumatized the disc, and the disc is affecting the nerve. And then you have also, again, pain down the back of the leg. So it's really kind of the same thing. It's just different versions of it, but it's very often starting with an instability in the lumbar spine. So again, if we have this erector spinae and the posterior hip tension, that's coming from, I just want you to understand that could be coming from an instability in the spine. But what I really want to talk about today is what effect that has on other muscles. So when some muscles are contracting, what they'll do is they'll turn off their paired antagonistic muscle. So the posterior hip muscles will bring your leg back, but the muscle that brings your leg forward and to the side is going to be on the lateral hip, on the front of your hip, called the tensor fascia lata, or the TFL, and that's connected into the iliotibial band. Lots of people know about iliotibial band. It's like pain, tension. Sometimes you have lateral knee problems as well. A lot of that's related to the TFL not functioning properly. Well, why would the TFL not be able to function properly? Why is the TFL not switching on to stabilize the lateral hip? It could be because the opposite muscles, your posterior hip muscles, like gluteus medius, would be contracting as a result of the extrinsic of the erector spinae muscles contracting. So you have erector spinae and gluteus medius contracting on your back and your hip, and what they're doing is they're going to be contracting these muscles, and it's going to actually switch off the muscles that are antagonists, or the opposite muscles. So one of the crucial muscles in the hip is called tensor fascia lata. If that muscle is weak, then you're going to have an instability of your hip as well. So, and then this turns into a whole bunch of other problems. So I really want to just highlight that when one muscle is contracting as a result of an instability, it actually triggers a whole chain of other functions where we have a weakness, and in this example, a weakness of the tensor fascia lata. Now, tensor fascia lata basically creates stability in the hip at the moment when our foot hits the ground. So when our foot hits the ground, tensor fascia lata stops our pelvis from sort of dropping and swinging forward. It actually stabilizes the pelvis. So if that isn't happening, then what can happen is it kind of feels like your hip gives way. You know, people will take a step and they go, oh, it felt like my hip gave way. That's a weakness of tensor fascia lata. And tensor fascia lata, that's in a heel strike scenario. It also, during heel strike, it stabilizes the lateral knee, and I can do more detail on that if you want. But because of the connection of tensor fascia lata through the iliotibial band into the lateral tibia, when your foot hits the ground with your knee slightly bent, it stops anterior translation of the knee and stabilizes the lateral knee. Now, if that isn't working, what happens is the knee can go too far forward. If you're skiing when that happens, you can blow your ACL joint, or playing tennis. If the tibia traverses too far forward because you don't have sufficient lateral stability of it, okay, pulling the joint back in, the knee moves too far forward, or your tibia moves too far forward in relation to your femur, and you damage the anterior cruciate ligament. Also, what it does is it stops the internal rotation at the knee as well, because again, you have this lateral stability pulling back. If you can't control the lateral knee, and it comes too far forward, it's also going to rotate as well. And if you have too much rotation in the knee, you start munching away at the medial meniscus. So how many people do you know who've had a medial meniscus problem, or an anterior cruciate ligament problem, or a lateral collateral ligament problem, or pain in the iliotibial band, okay, or pain in the lateral hip, or their hip gives way, or their leg feels heavy when they go up and down stairs, or their knee gives way? All of these things are very often related to weakness of tensor fascia lata. If tensor fascia lata is weak because the opposite muscles to them in the posterior hip are tight, and those muscles are tight because the erector spinae are also tight, and they're tight because of an instability in the lumbar spine, how likely is it that just stretching the back of the hip is going to fix it? How likely is it that just doing an exercise in the tensor fascia lata is going to fix it? It might help, but it's not going to be the fix. Just as I said in all the previous episodes, we have to work from the building blocks of stability. So if you don't first stabilize the lumbar spine, then you're not going to be able to resolve the tension of the erector spinae, and then you're not going to be able to resolve the tension of the posterior hip, and you're not going to be able to resolve the inhibition from the posterior hip tension of the inhibition of the tensor fascia lata on the side of the front of your hip. So if you can't stop that muscle from being weak, then you're going to continue with all these hip problems and continue with all these knee problems because you don't have stability in the hip or the knee. So this is just one simple example of how a lumbar instability can create a whole cascade of problems. So as neurologists, when we're looking at problems in the joints, or we're looking at performance of our athletes, we can't just look at a knee problem and say, oh, you got an ACL tear. I want you just to wear a band, or I want you to put some tape on it. That's not going to fix it. It's not going to fix it. If we're really focused on performance, we have to fix the stability first. It could be just a hip stability, or it could be a lumbar instability in many cases. But then there's even layers underneath that. So there's so much more to say about this. Actually fixing the lumbar spine, we could do it with adjusting to neutral and drive that joint back to a more stable position so that we're resolving the tension of muscles that are keeping the joint from being back at a neutral and stable position. We can do that at a local level, but sometimes we have to go another level deeper. So maybe I'll do that in a future episode as well. But I hope you've enjoyed hearing a little bit of the case scenario about hip problems and lumbar instabilities. And if you have any questions or comments, drop them below. I'll try to address those in future videos. And like it if you like it. If you don't like it, just tell me why. Tell me what else you'd like to see. And just want to thank you for watching. I'll see you next time.